Hello, everyone, and welcome. My name is Janine Campbell. I'm Head of Community Relations at Claris, and I am delighted to be your host for today's webinar, highlighting the amazing and transformative work being done by the team at the Lute Commission. The Lute Commission is a nonprofit organization delivering preventive and often life-saving mobile healthcare services to the underserved population of Eswatini, a country in southern Africa. With us today, we are fortunate to have Sam Riggleman, systems engineer at the Lute Commission, to give you a glimpse into their story. Specifically, you'll learn how their team uses the Claris platform as the hub to facilitate core business practices and achieve the continuous improvement and technology innovation needed to deliver on their mission as an organization. Without further delay, it's my pleasure to introduce you to Sam from the Lute Commission.
Thank you, Janine. Hello, everyone. Really excited to share with you today our story at the Lute Commission and how we've been able to innovate through a number of challenges leading up to and including the COVID-19 pandemic. Myself, I'm a mechanical engineer by trade. I worked at Cummins Diesel Engines in Columbus, Indiana, on a high horsepower engine project, and then in 2017 moved to Eswatini, where my wife and I were married, and then have been joined the incredibly passionate team of problem solvers and healthcare professionals at the Lute Commission, currently leading our systems engineering and software development teams. For those of you that mostly may not know the Lute Commission, it's founded in 2005 by Harry and Echo Vanderwall in the small country in southern Africa, Eswatini, bordering South Africa and Mozambique. It was largely founded in response to the HIV crisis and the lack of underserved communities to have affordable access to healthcare. And so the conviction from TLC from the onset was to go into rural communities and meet people where they were at and ensure that you never left a community until every patient had been seen. That continued to grow over time, and then in 2013, the Lute Commission was able to purchase property that's now known as the Miracle Campus, where we've seen a number of buildings and supply chain warehouses, logistics centers, outpatient, inpatient services, and then also most recently a training and leadership center. Last year as a team, we were able to see over 130,000 patient visits and a large percentage of the COVID-19 admissions in Eswatini. This is just a picture of an overview of our campus. You can see a number of our supply chain warehouses and really a very comprehensive operation to support the teams going all throughout the country providing compassionate medicine. We serve in a lot of different models. We'll have large outreaches, in several years back where you might see up to 1,000 patients in a day, and the team would leave early in the community would leave the community early in the morning and not leave until every patient had been seen, and you may see over 1,000 patients in a day. As a team, we talk about what sets us apart. We're always, emphasizing teachability, looks for solutions, committed to unity, dedicated to every last one, not about me, and attitude of gratefulness. And these really are our pillars, not just of organizational growth, organizational character, but of our digital solutions as well. And the ability to, work very closely as a team to innovate, rapidly adapt, receive feedback, appreciate the contributions of every team member is such a critical component to the innovation that we've been able to achieve together and, really push through every challenge that has come our way in pursuit of a solution. Just another view, we work with a number of towers in country where we're also moving internet between sites for a lot of our healthcare solutions. Several years back, we were really looking at what are our options as we look to build our digital ecosystem. How can we further empower the dedicated team of compassionate healthcare workers, support staff, who are willing to do whatever it takes to reach patients? How can we digitally empower that team with the best resources? And, we really saw a conventional development approach where you can get some front-loaded development efforts. A lot of developers, year one, year two, it kind of trickles down once you get the solution live. But we really didn't like the idea of decreasing development once it got into the user's hands. We really felt like this led to end user isolation, the feeling of kind of being trapped, the frustration of just those few features that you need, but, aren't able to get in the software that you use every day. And so we've really prioritized a modern low-code approach, which we think allows us to emphasize, the reality that users know best, and that it allows us to put tools into users' hands that they can constantly get feedback into, that we're able to, constantly tinker, innovate, and grow up, a larger and larger team of citizen developers who can work together with professional consultants, professionals, and really collaborate on solutions that are changing day to day. A lot of people will ask us, what version of FileMaker we're on, or what version of our applications we're on, and I typically just respond with the date. Where it's this date in May in 2022, and we're changing our servers every single day, our applications, editing live, and we'll show you a little bit of how that looked for us during COVID and what it allowed us to do as a team. One of the areas, obviously, as a healthcare provider was, how can we track and coordinate all of the activities of the team working throughout the country, particularly in the fight against HIV. And so it started with, a lot of art care, also an eye program, and then soon evolved into a full comprehensive set of electronic medical records. And so our team will leave, early in the morning while it's still dark, and they'll go out and they'll travel to, rural communities, primary schools, where they'll set up a full set of comprehensive healthcare services for a day. And they're all working digitally, working with iPads. And we needed a way to be able to, support those who worked at our Miracle Campus, but also support those who didn't have, really effective bandwidth. Maybe you're trying to see 1,000 patients in a day, but you don't have very fast internet. We needed to digitalize those processes, but not be slowed down by the availability of connection. And so what we set up was a team that would, basically use several of these Eero Wi-Fi mesh routers and connect them together along with a small Mac Mini, which was running for the FileMaker server, and then all of our iPads connected to this local server to store data. And then at the end of the day, that server would come back with the team and sync at the Miracle Campus. And really a lot of Claris partners that worked well with us in the beginning to help really plant these seeds of innovation and get a lot of our foundations set. Can't say enough about Soliant and 360 Works and Goya, who played, a huge role in kind of establishing the core foundation that we've built a lot of this ecosystem on top of. We evolved into inpatient admissions as well, and so we built, comprehensive medical assessments, vitals, medical orders. We incorporated wheelchair assessments as we're, trying to make sure all of the settings and fitments are correct as you're administering wheelchairs to underserved communities. And then we were able to incorporate SMS, where, we could send reminders for visits. We could, give, invitations to come for a comprehensive wellness checkup. We, at one point, had a challenge where you were trying to make sure that you had accurate phone numbers for your patient contacts, and we found that if we SMS'd the guest Wi-Fi voucher when patients were on site at our sites that had internet, then we were able to, give an additional incentive to having really strong contact data. We built all of our systems tied into Tableau and push metrics so that we could get real-time day-to-day charts that just sent to us in Slack. You could just, with one click, download the PDF, see your latest, data that was fed right from your digital systems. So this was really key for us to be able to, constantly pivot and align and adapt our strategies and our programs based on the data that we were collecting the day before, the week before, and not having to wait, long periods of times between those reports. Also really helpful to catch any data issues, application issues, and then solve those real time before you have a lot of accumulated error over a longer stretch of time. We also managed, from an employee side, all of our comprehensive scheduling, time and attendance. So we built in skill sets. You can see the progression of staff, always wanting to constantly be training. We call it the Joshua principle. Always be training the people next to you that can be doing the things you're doing today, so that you free up yourself for new capacity tomorrow. And the team has done amazing at constantly training up new leaders besides them. And then the ability that we have to schedule and assign every single staff that clocks in, several hundred staff in a day, both on campus and throughout the country, in a very highly coordinated fashion, where you can get your schedule via SMS. You can clock in via our clock-in terminals. We use facial recognition, for staff identification in our clock-in terminals, and then it'll tell you the assignments that you're working for the day, maybe some job responsibilities, and again, when you clock out, tell you what time you're coming in the next day. So, really the ability to constantly adapt, and especially leading into COVID, was particularly helpful when COVID-19 emerged and you had to, reshuffle a lot of your team allocations to get, a lot of your senior staff just supporting the medical functions. We were also able to, address the challenge of having to have senior trusted people manage petty cash distribution day to day. So, we were having senior people that were so capable of, tackling so many challenges, but instead were tied up, administering petty cash for a patient transport program that allowed us to give, small bus fare reimbursements for patients that we had met in rural communities and then came back to visit our Central Miracle Campus hub. And it was really the most effective way for us to continue serving them. And so certain patients would get sponsored and supported for the transport fees. And so we were able to link to the electronic medical records that if they had their lab result, if they were approved as a part of a patient in that program and had received all their services for the day, they can take their QR code, scan it at this ATM that we linked with FileMaker, and actually manage petty cash distribution this way. So there were a lot of innovations that were, that the team and our development team has done an amazing job constantly finding solutions to any challenge that comes their way, and getting really innovative in how they can integrate ATMs, machines, how we can constantly push for solutions based on user feedback day to day. And all of this as we approached COVID-19, I think there was a lot of core pieces set, but obviously none of us had any idea what we were in for when it came to the COVID-19 pandemic. I'll share some pictures and some slides just to help set the stage. When COVID-19, first emerged, I think a lot of us in the world, we didn't exactly know what it would look like in our area. But to give you a little bit of a picture in Eswatini, for us, we saw unprecedented levels of COVID-19 admissions and oxygen demand and severely critical patients, that really stretched the healthcare system and, stretched growth in a lot of areas and how you could respond to this, incredible surge of patients. And so as I think back to the times, one of the, amazing things about our team with FileMaker was that we were able to just go side by side with patients in the ward, with doctors, with vitals machines beeping in the background. If you've been in a COVID ward, you'll know what I'm talking about, but just, the sound of vitals machines all around you, the sound of patients fighting for their breath, the sound of ambulances rushing in and out, oxygen tanks moving. Just an absolute, team that is sold out, but just running from patient to patient, trying to absorb the volume and figure out where to go next. And, we pulled out our laptops, donned on our PPE, and you're just working next to the medical team, the doctors, you're seeing the things that they're seeing, picking up on some challenges, getting their feedback. And by the time you walk out of the room, those changes are live on their iPads and on their iPhones to continue fighting this battle as a team through the night. And so, we really pushed, how can we maximize every single resource through COVID-19 from a healthcare perspective, from vitals monitoring perspective. And it was a battle. You constantly saw day and night, there were very little periods of rest. You were constantly pushing from one patient to the next. I remember just walking to the ward at times and, just a constant whir of activity. Every bed full. We had patients in a triage tent out of the ward once we filled up all of our beds in the main hospital. We had patients out in this tent just waiting for beds to open up in the ward. And so, you were looking for every opportunity that you could to somehow, in some way, make a process a little bit faster, give the next patient a little bit better of a chance. And I remember at times you'd walk into a ward and you'd be trying to sort a piece of equipment. You'd be working with, oxygen equipment. You'd be, with the medical team, of course, only seeing a fraction of what the medical team was experiencing on a day-to-day basis. But you would leave the ward, and at times, you would see a patient that the team had been fighting for days, for weeks, maybe even longer sometimes, and you'd be in there and watch them lose the battle, and you'd you'd see the grief of the families, you'd see just the struggle of the team, after investing so much, believing the best outcome, giving everything they had. And it might be 2 a.m., 3 a.m., and you walk home from that and you try to fall asleep and you're so exhausted, and yet you just really are trying to process everything that's happening. And so some of those nights you just pull out your laptop and say, okay, what can we do? And sometimes I remember just walking back to the ward, pulling out my laptop on a rubbish bin and just seeing what other thing we could code to give the patients that you still saw in the ward the best possible chance of making it through this thing. All of our team was using iPads, everything coordinated for their vitals monitors, their medical orders, med distributions. We had digitalized every part of the process. Just to give you a picture here, this is just a little bit of the idea of the pace, but constantly day and night, there was really no lapse, but everybody was, coordinating who to go to next. And so we really used the software to give us alerts in Slack, to give us alerts in the system. We're onboarding a new patient, we're taking them into this bed, we're, sorting which rooms need the most critical attention for vitals monitoring, and we'll show some of those reports here a little bit later. You can see here just the amount of volume and activity. At one point in time, we had over 55 patients on ventilators at once. An incredible amount of support, and constantly looking for how can you, what's that next level that you could unlock to try and make sure that you're ready for any patient that came to you. And we built in systems to monitor all of our medical equipment, what ventilators which were running like 24/7 around the clock. The second they were done, they were getting serviced and prepped for the next patient to come to the ward. Team assembling ventilators in the middle of the night at 2 a.m., 3 a.m., 4 a.m., getting ready for transfers that were coming through the middle of the night. All of this, we were trying to manage and maintain, what equipment we had that was operational, what needed serviced, what could we allocate to who at any point during this pandemic. Our team was doing an amazing job working with Biomed to service them, maintain, various service events, dust filters, you name it, cleaning them between patients. You can see here how we built, a queue of vitals monitors, so we constantly knew, who was overdue for their vitals. We automated the frequencies and the intervals based on patient conditions. And, effectively the team just worked from top to bottom, a team that would constantly go around capturing vitals for patients. We built in graphs that allowed you to see the trend lines in their liters per minute of oxygen. You could see how much oxygen they were getting, their O2 saturations, and you can see the de-escalation of oxygen over time in this case. We also built automated alerts, so if they were overdue for vitals, which was inevitable when you had the volume of patients that you were trying to serve, and you could get alerts to, help a central team oversee, manage, and see, where do we go next? Who needs assistance? Maybe it's a mask that needs tightened. Maybe there's an issue with the oxygen. Maybe it's a ventilator setting, but, constantly, when you don't necessarily have, a full blown out vitals monitoring system, at the time, you do whatever you can do with whatever equipment you have on site. And so the ability to just rapidly build these systems, really allowed us to prioritize our resources in a very coordinated fashion. We also innovated a vending machine that was retrofitted to automate distribution of PPE. So, you can scan your employee badge. It automatically dispatches you, one set of 4 face masks per month, and certain departments, the N95. And then it's automatically managing that for several hundred staff, so that, again, your senior staff are not having to manage some of these more mundane activities that are incredibly important when it comes to maintaining the safety of your staff. The other really critical challenge for us in Eswatini was oxygen. And this is just a picture of, what might only be a day's worth of oxygen for us at the time. And so we built in reports that showed the liters per minute, the number of cylinders per hour that we were consuming, looking at projections and overviews of all the patients that were on oxygen, calculating what inevitably was always a limitation of the amount of oxygen that you could have or that you needed. At the time, no oxygen was produced in Eswatini, and all of it came from bordering South Africa. And so at times when you had COVID border closures, for us, COVID border closures also meant that oxygen trucks couldn't get through the border and deliver oxygen to patients in some of these scenarios. And so as a team, always looking for solutions, always saying, what could we do? We jumped off a cliff. The same team that was pushing oxygen cylinders in the ward, with construction capacity on site within our own team, built the shell of this building in 52 days, and we launched what was the first oxygen plant in Eswatini, and to this day, still the only plant in country that's producing oxygen. Within a week of rolling out this plant, there were borders closed in our country, and we had calls from around the country to provide cylinders to healthcare facilities, in many different areas. During the peak of the COVID-19 wave for us, the plant was running at full capacity, and at times even in excess of full capacity, supplementing with liquid as well. And so as a part of all of the coordination to manage the cylinder filling, the distribution of these, we built a FileMaker app that allowed us to track and barcode every cylinder. We tracked the fill times, so we knew the amount of hours that were left until we'd have more cylinders available to dispatch. And we would do various, pressure checks and monitor the fill rates of our cylinders associated with the PSA plant. So able to, again, in the middle of a really difficult scenario, provide a solution that, collectively, I think our rates went from around, 4 or 4.4 to somewhere around 2% mortality from COVID through the addition of the oxygen plant and other interventions of ventilators and the team's work through the third wave of COVID in Eswatini. And then having seen all of that as a team, obviously you're looking at what's next. How can we prevent this environment that the whole team is experiencing and work with the country to provide, solutions around vaccinations. And so we were approached by the Ministry of Health and asked if we could work together, on a national vaccination system that could help coordinate these efforts. And so we launched, in 2 weeks, we built the framework and the main part of the system to use Claris Connect to have a Ninja web forms on a WordPress site and register a patient's information, and then it immediately sends a real-time confirmation SMS and then gives you that code to sign in at your vaccination site. So all of this we manage through Claris Connect, FileMaker server through AWS, and then FileMaker Go devices in the field. So we can see here the online registration, the SMS, and then the full vaccine administration, inventory transfers, vial management, all of that we're managing in FileMaker Go. We utilized facial recognition as a very low-cost technology to minimize duplicates, where we only have maybe about 55% of the patients in our system that have a national ID. And so using facial recognition to speed up the process, minimize duplicates, find patients if maybe they had registered before and came back for a subsequent dose at a later time. We printed unique QR-coded vaccination cards in countries so that, for a market that a lot of people did not have smartphones, able to have unique QR codes that can be scanned at various checkpoints in the country and, directly linked to the vaccination system with their vaccination status. We built in various indicators to, indicate if they were not yet in the eligible age range criteria at the beginning of the vaccination rollout, various risk alerts if they had allergic reactions, bleeding disorders, things that maybe the medical team would want to discuss with them. All of these checks and conditions were built into the vaccine administration module, and then we got day-to-day Slack reports and also in Tableau and push metrics where we could monitor the vaccine totals at various sites and prioritize and drive program strategy around where we were seeing the highest yields. I think for us, the SMS probably played one of the, biggest roles from the digital standpoint in being able to, allow people to register as soon as they were eligible. We could send an SMS to them, and then for every subsequent dose, whether it was dose 2 of Pfizer, now it was boosters, you're able to send that SMS, immediately on an automated schedule and mobilize your patients to site. WHO actually recognized Eswatini's efforts, showing that, analysis by WHO that Eswatini gave more vaccines per head than any other African nation during the first phase of the COVID-19 vaccine rollout. And Eswatini gave nearly 110% of the doses they received as they made use of every drop of every vial. And if you know that, from the vaccine space is that a lot of these, vials have a little bit extra that you can draw out of each one. And so when you're able to manage and coordinate, what's, a very limited resource in your vaccinations, especially in, less resource settings, I think it was a real win for the country and for the team to be able to roll out these systems in a way that could coordinate and get the absolute best yield out of every vial. So we really appreciated the chance, just to kind of walk through our story and the ability of us to constantly innovate, see a challenge, bring a solution, see a challenge, bring a solution. And, what are those things that at times were barriers to, saying yes to good ideas? You think about how can you just take in the feedback from the team that's seeing the challenges every day. They have amazing ideas, and the quicker that you can incorporate their feedback, the more feedback that you get on a day-to-day basis. And so, trying to create this engine, this innovation engine that's fueled by user feedback, and that's able to drive and innovate and take the next steps, but is so dependent on being able to respond and adapt as quickly as possible to the feedback that comes from users. And the biggest thing I think it's done for us, allowed us to hold the keys to our digital future. When COVID hit, and throughout the last 2 years, 3 years, the only thing that we could do when supply chains broke down, when so many things were out of normal operations, was what you had in your team, your people, your developers, your ICT teams, your medical teams, your support teams. The people that you were surrounded with are the ones who could get you the solutions of where you wanted to go. And so the ability to contain all of that internally and innovate and adapt your server technology, adapt your applications, really allowed us to, I think, tackle these challenges in a way that it's hard to imagine how else we might have, really been able to digitalize some of these processes. So really appreciate Claris and the team, and so much of the Claris community that's played a huge role in our growth as an organization, reaching out in the FileMaker platform, talking about ideas, batting around solutions together. I think really appreciated just the commitment of the entire Claris community to first and foremost being helpful before being successful. And the partnerships that we've had, we can't thank you enough. You really have played a huge role in helping us reach every last one with compassionate care.
Wow. Thank you, Sam, for that inspiring presentation. We are really grateful for the time you've spent with us today. And now it's time to answer any questions that you have about what Sam shared. Be sure to enter those now if you haven't done so already. While you're doing that, let's talk briefly about a new program offered by Claris. Claris recently announced a new program that gives you the freedom to explore, prototype, test, and build in ways that bring value across your business. It's called the Problem Solver Circle, an exclusive new program that gives you access to the entire Claris platform, everything that we offer for all of your employees over a 2-year period. This means you can use Claris FileMaker to build custom apps, integrate those apps with other systems using Claris Connect, and get a developer preview version of our latest offering, Claris Studio. You'll have the freedom to build so much more over those 2 years without any licensing limits. And it's only a little more than your current licensing cost. To learn more, scan the QR code on the screen, and there you can also sign up to be contacted by someone from our Claris team to discuss the Problem Solver Circle in more detail. I will ask a question, and hopefully if he can't speak, he can type it into the chat. Sam, the first question that I have is, you mentioned your developer team. Can you talk about how you identify and train up those developers to take on the work and the maybe projects that you have in your backlog as you look ahead?
Yeah, thanks a lot, Janine. So we really have a mix of some developers that are working remotely, a really sold out team that's working on site as well, all working together to take the feedback of end user developers and create a backlog. So we are working increasingly in a more agile type fashion. So we're getting more and more to where we'll get feedback backlog task in, and then we'll translate these into business requirements and then what's needed from the development side, and then take those through a process of development and constant prioritization. So really prioritizing feedback from the team that's coming in day to day, and then trying to push those as quickly as possible.
Yeah, I mean, certainly important to make sure you're prioritizing work and that you have the right team members to tackle it. So, I totally understand that. We have a question around your SMS notifications and the tool you're using to push those out. Can you share more about that application?
Yeah, so we're using a few tools for SMS. For in-country in Eswatini, we actually developed agreements with the two main cell carriers, MTN and Swazi Mobile. So for those, we're just using basic insert URL statements into their systems. And then we also use Twilio and bulk SMS. So bulk SMS we're using mostly for South Africa numbers, and then Twilio we're using more on international numbers in those scenarios.
Awesome. Thank you so much for sharing that. I see a question that I'll take, Sam, so I'll give you a moment. There's a question about learning more on the problem solver circle. We have a team of people ready to help answer your questions. So what I would recommend is that you scan the code on the screen and request to hear from someone on our team if you want to learn more about problem solver circle. And we can also flag it for someone on our team to reach out to you directly as well. Let's see what else we have. Sam, can you talk more about how you have found extra support, whether it be through, you mentioned, partnerships and Claire's community and getting support when needed. Can you talk more about what that experience is like and what you would recommend to anyone, looking for extra help for their own application development needs?
Yeah, I think we were really fortunate to have partners like Soliant 360 Works and Goya who helped us a lot in the foundation. I think for us that was really critical to understand best development practice, architecture practices, and then have something that we could replicate in a lot of different settings. So I would definitely encourage if you're new or getting started, especially tackling large things in the ecosystem, find those who are really experts in that space and get their input into the origins of your design. And then from there, we worked a lot as a team, around the clock trying to find solutions. And so, we've used the community forums especially frequently, and we're just amazed at how, within an hour or 2 hours, you get answers back that were relevant, practical, helped address your challenges. So we really poured into those, and then, just did some practical, how do you develop different types of things in your solution with developers and just kind of plug them in right away, tackle the challenge, and then work through code reviewing and understanding some of the principles of citizen developers and translating business challenges into development solutions. So I think really kind of having that mix of the consultant kind of overview architecture input, and then using the forums, using the online articles that are out there, really is quite a bit available online to support us in those cases. And then just obviously within the team members that you do have, talking through and exploring solutions together.
Yeah, thanks, Sam. I know you've been really active and a good advocate for, the community at large and partners for their support. And there definitely seems to be some interest in kind of getting more info about the applications you've developed. So I encourage those here who want to engage directly with Sam to get more details about what applications have been developed. Please connect with him via the Claris community, and we'll do our best to facilitate follow-up conversations featuring Sam to get more in-depth glimpses into the applications that he's and the team at the Loop Commission have created. in the coming weeks in the Claris community. So Sam, I won't put you on the spot here, but there's definitely interest in seeing more of what you've developed to manage the work and the processes for the Lou Commission. One question for you that came in: are the solutions developed in the FileMaker scripting language, and what other key technologies were key to you delivering on the services that you provide?
Yeah, it's a good question. So most of what we've developed is all within the FileMaker scripting language. I don't think we're actually using any plugins for anything that we showed today. So we've really prioritized to be able to constantly keep up with the latest FileMaker server releases, not have any bottlenecks, and staying with whatever the most recent software available is. Not really relying very heavily on plugins. There are things we're using. For the ATM, we're using some ActiveX integrations, and then for some of the charting that we showed, we're using C3 charting for those. But otherwise, really, for the most part, using just the native tools within FileMaker, and then using Microsoft Face ID for biometrics, and then using Claris Connect, pushing more into that for a lot of our integrations and integrations between WordPress and websites, and using Ninja Forms to get into FileMaker.
Awesome, thank you so much. So we're coming up to the end of our presentation. I'll just take another minute to see if any other questions come in. Sam, is there anything more that has come to mind that you'd like to share to provide guidance, direction for anyone listening in today? I mean, you've done so many amazing things, and I'm sure have many more on the horizon. Is there anything that you'd like to share before we wrap?
Yeah, I think just to really appreciate the whole team here, and the spirit of development that exists, and solutions focus. It's been a really exciting journey for us to work with so many people that are dedicated and committed to solutions. And it's easy to sometimes get stuck behind what it looks like to transform business operations, but when we have the ability to take technology and transform people's lives, I think that's where it becomes really powerful to be a part of. And so we really appreciate all of the inputs from those that have worked with us, and just the way that we've been able to use our skill sets in a technical standpoint and apply those to human beings each and every day, who can benefit and be inspired by it, and hopefully provide a really high quality healthcare service at a very affordable rate, and offering it free of charge to our patients. It's not something that, as an engineer, I initially ever envisioned being a part of in the development space and in the software development, but the ability of the platform to allow good ideas and just solutions focus to get you to this point has been really exciting. So thanks a lot to the whole team.
Well, I mean, and thanks to you, it definitely seems like you are succeeding at your mission to provide those services and healthcare access. So congrats and thank you to you as well. And continued success to you. Okay, so one more technical question before we wrap, and that is around implementing facial recognition. Any further explanation or guidance you can share on that piece? And you don't have to go super technical. We can always take those in a follow-up in the community, but any highlights you can share?
Yeah, we can share a follow-up, maybe article about how we did that. We actually use it for 100% of our staff, clock in and clock out, and more or less you can actually build like a profile of pictures of the same person over time. And then, so you're actually comparing an image to multiple image profile that you have of a single person. And it's, we do thousands upon thousands of queries a month, and it's probably less than $100 a month. So it's very low cost. We had done fingerprint recognition as well, which struggled with younger children, less than 13 years old, and also struggled with more agricultural settings, required additional hardware. And we've just really found that facial recognition, is the simplest way for us to manage identification. But we can put some more articles out there, I think, following this, about how we've done it.
That would be great. Thank you so much for continuing to share that expertise. I know, the developers in our community are always looking to learn from each other. So we really appreciate that you're ready and willing to share. With that, everyone, we're coming to the end of our time, and I don't see too many more questions, if any. I want to thank you all for joining us today. For those of you interested in the Problem Solver Circle, I have your contact. We will make sure somebody reaches back to you to get your questions answered. Thank you for your interest there. Sam, thank you so much, and to all at the Luke Commission, not only for sharing how you're using Claris and how it's helping you in your mission, but for doing what you're doing. It's truly inspiring, and we're grateful to see it. If anyone listening today wants to learn more about the Luke Commission and their mission in Eswatini, we've put their website in the chat, so please explore more. And this webinar will be available for viewing as it has been recorded, so you'll be able to access this in the coming days off of our Claris YouTube channel. And we appreciate your time today. So thank you all so much for joining us. Sam, thank you again.
Thank you so much.